Yeah, so Antara is a wonderful patient who's been through a lot in her life medically despite her young age.
It all started with cancer when I was 17. I got tuberculosis when I was 21. It got relapsed when I was 22, and I had to go through heart and lung transplant when I was 28. And at 37, I had to go through kidney transplant.
She developed kidney failure from past medications as well as the anti-rejection medicines that she needed for her heart and lung transplant. So she then presented to us with chronic kidney disease and on the verge of having to start dialysis, seeking a kidney transplant. From a long-term perspective, dialysis, although would have kept her alive day to day, certainly would have expected to cut her life expectancy in half compared to getting a kidney transplant.
I'm so lucky that at that time, when I said I need kidney, everybody was like, oh, we are ready to donate. So luckily, my mom's kidney matched really well.
અંતરાને સારી જોવી છે, મારું જે થવાનું છે થશે, મને મારી લાઈફની બિલકુલ ચિંતા નથી, પણ અંતરાને મારે સારી કરવી છે. That's the goal.
There are many important differences between receiving a living donor kidney transplant versus the deceased donor transplant. There are nearly 100,000 people in the United States waiting for a kidney transplant, so the waiting period can be 3 to 7 years, depending on blood type and other factors, for a deceased donor transplant. Short term, the kidneys from a live donor work more rapidly and patients recover more quickly from their operation as a result of that. And on average, a living donor kidney will last 50% longer than a deceased donor kidney transplant.
He explained where the kidney is going to be, and we had to meet both teams, for my mom and for me. So I met Dr. Desai, and it was pretty straightforward. They told me, they showed me where exactly kidney is going to be. They said it was going to be on right side. Initially, I thought maybe they take the kidney out, but they said no, they don't even touch that because it's way back. It's more complicated. So right now I have 3 kidneys, 1 on 2 back and 1 in the front.
Her surgery itself was fairly straightforward for a live donor transplant from a technical aspect, but from a medical standpoint, there was a lot of thought processes that had to go into her overall care. She's been on immunosuppression for many years, so how that affects the immunosuppression that we give around a kidney transplant, there's certainly an impact from how we think about that. There's also considerations in the fact that she's had a prior heart and lung transplant, so the anesthetic care and the immediate post-op care has to keep that in mind carefully as we get her through the procedure and the immediate post-op period.
Any doctor that we are attached to is associated with Hopkins. And that makes it very, very simple. We have the lung team and the heart team and the kidney teams who can coordinate and come up with a decision.
We have a large multidisciplinary team of physicians, nurses, occupational and physical therapists, other support staff that are very involved in the care of the patient.
But back more on the ladder.
2, 3.
Antara is back to work within a few months after the transplant as a physical therapist and has continued to thrive and do very well. She has great kidney function. She's not had any bouts of rejection. Her heart and lung transplant continue to function very well.
Life is normal. I think that's what we wanted to achieve.
It was a very interesting year for me. I'm so grateful that my mom gave me the best gift I can ever ask for. That's why I'm here. So she gave me birth again.
I am not the hero, Antara is hero in this story.
I think that's what I've learned, that I just have confidence in my doctors. That helps me go through everything. I'm just so grateful to be here.